masturbation, yes? This Catholic doctor is saying that this is sexual pleasure to be taught as a right. Let me just read this. If we allow sexual pleasure to be taught as a right, what happens when one's to the pleasure and there is no consenting partner of the opposite sex? This will create perverts who will engage in masturbation, same-sex relationship, rape, bestiality, incest, teenage sex, and abortion. They told the lawmakers. Now, how is this a gross misstepping? How do you interpret, first off, how do you interpret this bill, the seventh clause, which deals with the reproductive health of the youth? How do you interpret it, and what is your take on this?
So first of all, earlier we had said that the Constitution of Kenya actually provides the right to reproductive health.
Yes.
So that's a right that is enshrined in the Constitution. Mm-hmm. Which, if the Reproductive Health Act does not introduce new rights. So the role of Parliament is to enact legislation that will help us realize the provisions of the Constitution, because the Constitution cannot implement itself. That is why, for example, we call 43(1) of the Constitution that provides the right to health, and then we have a Health Act, the Health Act of 2017, that provides for how that right in the Constitution will be realized.
Okay.
So what we're doing now, and what Parliament is doing now, is developing an act to realize the right to reproductive health care as provided for in the Constitution. So it is not that we are introducing new rights. That's the first thing that we need to
get it
clarify.
Okay.
There's no right that is being created. It is the right that is enshrined in the Constitution that is being realized. The second thing is that reproductive health and reproductive rights are very, very broad, very many. For example, you have the right, for example, to choose a partner. If you want to get married, for example, you can decide who you want to get married to. You can decide if you want to have children, for example, or the number of children that you want. You can exercise your rights, for example, to accessing contraceptives, for example, or whatever right it is. So it's a broad range of rights, and it is not just the rights as the doctors are saying. So they are fear mongering. They are using disinformation and misinformation, and they are creating a situation whereby people who have not naturally going to oppose the bill even without looking at the bill. So it's very, very important for us to be able to correct that narrative and give the right version, because what they are saying is definitely not there. And you can ask them what clause are they referring to talk about that the bill would encourage bestiality, rape, or some of these issues. Having said that, it's also very important to say that already, even without the bill, we are having issues around young people who are being defiled. We are having a lot of issues of teenage pregnancies and safe abortions. Girls are dying from unsafe abortions, and yet nobody wants to talk about it. So it's like they're saying that these things currently do not exist. If we create this bill, then we will have teenage pregnancies and unsafe abortions, which is literally
it is false.
Could not be further from the truth.
Yes. And what I see is that a small part of the bill is taken, and then they run with it. They run with it like the wind. And then it is pretentious to think that we live in a bubble, that these things don't happen. And as you had stated earlier, in our African tradition, it's really difficult to talk about these things which are quote unquote sensitive. But when something such as this is brought forth, it is met with a lot of repulsion from the people, from the clergy, from basically majority of the people. But there is no solution that is given from them. They won't say that, okay, this is not the right way, let's do this way. They just say no, and then just go back to burying our heads in the sand.